Hello, everyone. In the era of COVID-19, the coronavirus pandemic that has swept through not only our nation, but across the world, I'm here to offer you some messages of hope, knowledge, and information for our patients with myeloproliferative neoplasms, MPNs, and their families and caregivers. It's my honor and really a privilege to be here with you for a few moments to kind of take time away from patient care to give you this message. A few things that have come up in the coronavirus era for our patients with MPN, I think will be of high interest to the viewers of this broadcast. Number one is the most common question I'm getting is, Dr. Pemaraju, what should we be doing with the current medications that we're on right now as a patient with MPN? Specifically, that some of these medications are actually chemotherapy drugs and can lead to higher chances of infection, including viruses. So I'd like to start with there. The first thing I would say is always talk to your doctor, as you might expect. So we can't give specific medical advice on a format like this. But one key feature is if you're already on medications, as you're talking to your physician, we don't want anyone out there abruptly stopping their medications because of this current pandemic. An example of that is patients who are on JAK inhibitors, and if they abruptly stop it without medical advice, there is such a thing as JAK inhibitor withdrawal or rebound syndrome. So it's just kind of a reminder that you must talk to your physician, even if you're on medications that are immunosuppressive or myelosuppressive. So let's keep that in mind. So case by case basis. Number two question is that some of these medications, the JAK inhibitors in particular, interferon, can lead to increased chance of viruses, true or false. Actually, that is true in a lot of our patients. We know that already, that the underlying disease itself, for example, take myelofibrosis that many of you out there have, or the treatments that we give for the myelofibrosis, yes, those can increase what's called immunosuppression, the ability for the body to get more illnesses, including viruses and bacterial infections. That is a true statement. Now, having said that, some of these medications may have a net benefit for each of you out there individually. So I think the second point here is to understand the ins and outs, side effects, and toxicity profiles of your medications way before and after the COVID-19 pandemic, but specifically during it, to rediscuss with your physician, your treating team, what is that risk-benefit ratio? So I think that's coming up a lot in the clinic. And do you need medications or other preventative measures for sort of the common viruses and bacteria outside of the pandemic? Another issue that's coming up is, hey, I'm seeing that some of the medications that I'm on or that I have been considered for being used as a treatment for COVID-19. This is a very hot, important topic to many of you, and that is also true. An example of that are the JAK inhibitors themselves. Did you know, these are all fully publicly available in the last 2 weeks, that several of the JAK inhibitors that we know and use in the clinic, including ruxolitinib and others, are being put forward in large-scale phase 2, phase 3 clinical trials for possibly testing the hypothesis that these drugs could help in severely affected COVID-19 patients. Let me tell you a little bit about that. That's going to be of interest to many of you out there. The COVID-19 virus, we're learning so much about it every day, and I'm sure the moment that this broadcast comes out, some of this may be outdated immediately. But what we know about the virus is in some patients, not all, but in some, it leads to the body's immune system being hyperactivated or overactivated. Many of you out there are already familiar with that, with the MPN disease process itself. That overactivation is called CRS, or cytokine release syndrome, or STORM. And we see that in immunotherapies and CAR T cell therapies. This is something different. This is caused by the virus and the body's immune reaction to it. Well, if these JAK inhibitors, what they're supposed to do is reduce inflammation and this cytokine cascade in the body, the hypothesis or question is that maybe they can be tested to abrogate or hold off or stop this same cytokine process in COVID-19. That's very interesting. And importantly, those are not just patients with MPN. They're meant to be a broader swath of patients. So can you believe it? In 2020, ironically, that sometimes the same class of medicines, which may lead to immunosuppression and increased viral infections, now may be co-opted in clinical trials to hold off on the more serious effects of the virus. That is unbelievably important. And so No, your brain is not exploding. You saw that right when you saw that press release, because all of you out there know what I'm talking about. Okay. Now, as with anything, clinical trials, as Anne and this network has reminded us many times before, and I, as an investigator, clinical trials are just that. By definition, these are unproven. By definition, this is a guess, a hypothesis, a theory that we and others have that we must now investigate in brave patients and families such as yourself. So remember, just because a clinical trial has been launched, it may or may not be right for you, your loved one, and you need to really look into these things, both for your MPN and during this pandemic. So I think that's something that's very important. All of this is in the public domain. It may take a few hours to find, so I wanted to put that out there for you. Now, the next issue for us to discuss, team, is that of how do you find reliable information as a patient with a myeloproliferative neoplasm during this scary and uncertain time. I'd like to give you three resources that may be a bit more specific to our audience out there. Number one is social media and Twitter. That's right, I just said that. Many of you who've been following me and Ann Brazow and others over the years know that in combination with our other colleagues such as Ruben Mesa, Aaron Gerds, and others, many of whom you've seen on these programs, we built a network by investigators and for investigators, and that's called hashtag MPNSM, or hashtag myeloproliferative neoplasm, in social media. This is something that I co-founded with some of these investigators. And what it is it's an open channel on Twitter, on social media, for us to discuss topics of the day. So I encourage anyone who's out there to not only look on there, but also to contribute and ask questions if you would like. It's a running discussion. So Twitter is a quick message platform for some of you who are not used to. Many of you are used to Facebook, which does not have a character limit. But check it out. We and others are discussing what to do for our patients with MPN in general terms, right? This is not for specific medical advice, but I think this is somewhere where you can pick the brain of someone such as myself, Dr. Mesa, others directly. And so I think that's a key place for our MPN patients to find MPN-specific information during the pandemic. Number two, another nice platform are the advocacy groups that specialize in MPN. You know about a lot of them. The MPN International Advocacy Foundation, Patient Power, all of these organizations that are out there that are specially designed for patients like you and caregivers. So take a look at those that have a presence on Facebook, Twitter, and all of these other places. And then number three, this is an interesting thing. I would recommend, because the New England Journal of Medicine, the NEJM, is actually a public entity. You may not be able to have access to the full articles, but I've started to encourage patients and caregivers to at least take a look at what's going on there. New England Journal, interestingly, comes out once a week. It's not once a month. And this is the most prestigious of all of the medical journals. Again, you don't have to know the jargon and read the full articles, but at least if you go on Google, go to the New England Journal website, the abstract is there, and what we all as doctors are talking about are there. I think it's an unbelievable resource. The phrase is getting information from the horse's mouth, straight from the horse's mouth. That's the case here. Honestly, the way we write these abstracts for New England Journal are usually written, if not in layman's terms, in a very widespread understanding. And if you're a patient or a caregiver out there, I encourage you to look at that, because then you'll see what all we're talking about as investigators in terms of COVID-19. What are the big issues? This is a bit not specific to MPN, but at least it covers patients with cancer and other conditions. And then you'll know what's coming out. What are the latest studies coming out of China, out of Europe, out of the United States? There was a trial with the drug called remdesivir that many of you heard about. And that data actually is published in the New England Journal and other high-level journals like that. So you can at least see the data for yourself. Or if you don't want to look at the data, at least you know, okay, here's what's actually published in the scientific journals. And then you can go to the other media to kind of see the interpretations of it. The last thing I'd like to leave you all with, during the pandemic, I just got off the inpatient rounds during the entire month of April. This is something very important for our audience. Although 99% of my patients were not affected by COVID, the effects are felt by everybody, by the doctors, the nurses, the staff. There's a certain sense of loneliness, depression, heartache, and isolation that I saw among the patients who were hospitalized in the hospital, not because of COVID, but the indirect effect, restricting visitors, social distancing, limitation on shaking hands, hugs, physical contact. I find this to be a devastating and untold aspect of the COVID-19 pandemic. For especially for our older and immunocompromised patients, many of you out there, this is a tough part. If you have to go to the hospital, yes, absolutely go. Me and my colleagues are there ready to treat you, and you need to be in the hospital. And so, what I wanted to encourage you is to look for creative ways to include your loved ones into your life. If you have to be hospitalized, one thing I found on the rounds is even if you don't have access to, we have access to telemedicine. So, iPhones, video chat, cell phones, internet technology, even if you yourself aren't savvy with it, I was able to put on the family member who normally would be at the bedside in real time during the rounds, in real time, not later on, hey, this is how Mr. X is doing. That was powerful. It doesn't replace human touch, but it allows doctor, patient, and family member to have a real conversation in real time. Number two, I would encourage all of us, young, old, cancer, not cancer, MPN or not, to take pause. That's what I've been able to do with my family. Take pause and to think about what are your goals of care? What do you want in terms of a ventilator, mechanical ventilation, ICU bed? What are your goals? DNR, DNI, do not resuscitate, do not intubate, advanced directive. I think these are things that we sort of talk about in and out of the clinic before the pandemic. But I can tell you that because of this, younger and older patients have really had to have serious conversations. And I think if you have a partner or a loved one, it's important to have those conversations before that time comes so that everyone in your family is aware. And so that way you can facilitate those discussions if that's needed at the appropriate time. And then the final message I would bring to you is the power of the healthcare team to connect with patients at a level that's beyond the job description. I saw so many moments of compassion that blew me away this last month. Again, these are family members. These are patients where the family member is not there at the bedside. So I saw staff, particularly the nurses and advanced practice providers, you can't stand in or step in for the family, but as best as possible, giving love, support, talking, companionship during these rough times when visitors are not allowed. This moved me in a way that I may not be able to express on this broadcast, but I look forward to sharing those stories both in the written word and in future interactions like this. And when we go back to our town halls together, whenever that date may be, I'd like to share more about that. So, in conclusion, what I would say for our patients, caregivers, and families who face MPNs every day before, during, and after the coronavirus pandemic is that there's a lot of hope and optimism for our field. In that our patients, by and large, still will connect with their medical communities in whatever way possible. If it's not the in-person visit, through telemedicine, which has really gotten a lot of innovation because of this. So phone calls, video visits with your doctor, checking about your medicines. Number two, that some of the medicines and chemos that our MPN patients actually are taking right now may actually be useful and investigated for treatment of the severe effects of the COVID-19. And then finally, all of us together as a community, doctors, patients, family members, finding innovative and seriously new ways to connect with each other when the in-person touch, physical exam, and interactions are limited to be able to continue an unbreakable partnership of care and health, especially after this pandemic is over. And with that, I want to conclude with sending all of you lots of love, warmth, and safety. And we will all be together again one day. Thank you so much.